Hello, welcome to our OB Nursing 240 case study presentation. Our case study is about Teresa. She is a 40-year-old Gravida 1 Para 2 female. She is married with a 2-year-old daughter at home. She is 32 weeks gestation. She is concerned about the safety of her fetus. Let's join Teresa at her appointment now.
Hi, my name is Jeannie, and I'm going to be your nurse today. I understand you've just been diagnosed with Placenta Previa. Can you tell me how this makes you feel?
I'm so worried. I never expected anything like this. My first pregnancy was so perfect. Is my baby going to be okay?
I'm very concerned about our baby, and more importantly, my wife. Is she going to be okay?
Placenta previa occurs when the placenta abnormally implants in the lower segment of the uterus near or over the cervical os instead of attaching to the fundus. The abnormal implantation results in bleeding during the 3rd trimester of pregnancy as the cervix begins to dilate and efface. Placenta previa is classified into 3 types dependent on the degree to which the cervical os is covered by the placenta. Complete or total, when the cervical os is completely covered by the placental attachment. Incomplete or partial, when the cervical os is only partially covered by the placental attachment. Marginal or low-lying, when the placenta is attached in the lower uterine segment but does not reach the cervical os. Risk factors for placenta previa: previous placenta previa, uterine scarring, maternal age greater than 35, multifetal gestation, multiple gestations, or closely spaced pregnancies.
Teresa, can you describe your bleeding for me?
It's pretty bright red, and the amount varies, but usually I have to change my pad a couple times a day.
Okay, let me just take a look here. Okay, any pain in your belly at all?
No, no pain.
No pain. How about contractions? Have you
Oh
been
no,
having
nothing like a
contractions?
contraction, no.
All right, have you noticed leaking any other types of fluids?
No, nothing but the blood.
Blood. Okay, I'm going to have you lay on your left side just so we don't compromise the circulation to the fetus, okay?
Okay, that'll help?
Yeah, that'll help.
Okay.
Some common labs and diagnostic procedures for placenta previa are as follows: hemoglobin and hematocrit for blood loss assessment, a complete blood count, a coagulation profile, ABO blood typing and RH factor, and the Kleihauer-Betke test, which is used to detect fetal blood in maternal circulation. Ultrasounds, either transabdominal or transvaginal, to check placement of the placenta, and fetal assessment monitoring is also performed to assess fetal well-being.
The doctor is allowing you to go home, but you will have to be on bed rest.
Why does she have to be on bed rest?
Well, it will help to decrease your oxygen demands, which will in turn lower your cardiac output and decrease your risk for hemorrhage.
That just sounds so serious. Am I going to be okay? Is the baby going to be okay?
There are some very serious risks associated with your diagnosis, which is why it's so important that you follow the instructions that I'm about to give you. There is a chance you may need blood products at some point, and I am going to have you sign this consent form before you leave. Now, even though you are going home, it's very important that you let your doctor know if your bleeding increases. Also, absolutely nothing inserted into your vagina, so that would include sexual intercourse. And you should let us know if you're experiencing any dizziness, faintness, or decrease in urine output.
What happens if I go into labor? Is everything going to be okay?
Potential complications of placenta previa. Hemorrhage is expected secondary to the poor contractibility of the lower uterine segment. Planning delivery and control of hemorrhage is critical. Preterm delivery, congenital malformations, abnormal fetal presentation, placental abruption, and higher rates of blood transfusion.
What other concerns do you guys have?
How am I going to take care of my 2-year-old if I'm in bed all day? And what about the house? And meals. Who's going to do all this?
It's okay, honey. Calm down. I'll do what I can to see about changing my schedule at work and see if I can work around the hours. And I can always call my mom and see if she can come and help.
Oh, honey, your mom is just too old. She's not going to be able to keep up with Ginny. And what about my work? I was supposed to work for another 7 more weeks. What are we going to do?
Do you guys have any other family or friends that can help you? How about neighbors or maybe the church you attend?
There is Sally. She has the little girl that's 2 and is wanting to get our kids together. She could probably watch our little guy and help out.
I don't know. I just don't like having to ask other people for help.
That's understandable, but I do have a brochure here with some additional resources that may help you.
Oftentimes, being on bed rest can be a burden when trying to handle daily responsibilities, but it is crucial in preventing complications during pregnancy. Several resources are available to help. Family or members of your church, local offices such as Job and Family Services, which may offer programs to assist with paying for childcare, pregnancy support centers, and here locally in Stark County, an organization called Help Me Grow. There are also several online resources available to help you.
The teaching opportunities in this scenario included bed rest, report any bleeding or changes, insert nothing vaginally, and blood replacement as prescribed. The nursing diagnoses demonstrated were knowledge deficit related to lack of information as evidenced by questions, risk for decreased cardiac output related to excessive blood loss secondary to placenta previa, anxiety or fear related to threat of loss as evidenced by fearful attitude, and ineffective coping related to situational crisis as evidenced by verbalization of feelings.
Honey, could you bring me a glass of water, please?
Sure, I'll be right there. Here you go.
Thanks. Look at this website the nurse told us about. Maybe we can get some help from these people.
Yeah, that looks good.
What do you need?
Where's my paper?
I don't know, this one isn't right
Here.
Do you know your lines?
No, not yet.
Do you know your lines?
Peace out, baby.
Code red, main 4.
Hey,
Code red,
smile.
4 main.
We're gonna do outtakes.
Code red,
Mary.
4 main.
Where's my outtake? I want my lines.
And here locally in Stark County, an organization called Help Me Grow. There are also online resources available also. Here locally in Stark County, an organization called Help Me Grow. There are also several online
We can get some help.
The abnormal implantation results in bleeding during the 3rd trimester of pregnancy as the cervix begins to dilate in the face. Can we do that again? Placenta previa is classified into three Are we ready?
I wanted to get your tennis shoes. Oh, you didn't. All right, hold on. Oh, I'm still recording. Shoot.
Risk factors for placenta previa. Previous. Oh, stop. You're
Up here you go.
That's where I go first.